So now let's talk a little bit about weight stigma and IIH. So like I mentioned in the beginning, IIH and weight stigma, it's relevant to talk about these two topics together because in the context of IIH, because of the high prevalence of obesity among patients with high IIH. Weight stigma can impact the diagnosis of patients with IIH, and it also can lead to inadequate treatment and disease progression. So I'm going to try to illustrate it from this diagram. So let's say that there's a patient with obesity, female patient with obesity and IIH, undiagnosed IIH. So this patient has been through multiple healthcare professionals. Most of them have not been great encounters. Most of them have focused only in her weight. So this patient consults for severe debilitating headaches. She decides to consult with a healthcare professional, with a primary care physician. And this primary care physician, let's say that this physician has been seeing multiple patients that day. So this is his last patient of the day. And then whenever he gets to the consult, she starts telling him all of her symptoms. I've been experiencing these really terrible headaches. They're super debilitating. I have some vision problems. And this physician, while looking at her, his mind and his brain probably goes to, okay, this is sort of an easy case. I know probably what's going on here, and I know it's probably the weight. We know that excess weight is going to cause multiple things that could manifest in debilitating headaches, and all of these things will probably get resolved with weight loss. So then this physician will say to this patient, okay, I understand that this has been difficult for you, but I know that a lot of these things can be affected by your weight. So let's try to do this. I'm going to give you a meal plan, a 1,200 calorie meal plan. So you can do this 1,200 calorie meal plan for a month. You can try to exercise a little bit more so you lose some weight. And then we can see each other in one more month. If the symptoms persist, maybe we can do more extensive testing. But if the symptoms change or improve, then it was probably just the weight. So even though it's not ill intention, it wasn't something mean, the physician just wanted to help. This was a weight-centric focus because the physician only recommended weight loss strategies as a treatment approach. What happens with this is that this patient is going to have a lot of psychological impact because she will realize that she was not being seen. The only thing that physician saw was her weight. She wasn't seen. The only thing that was seen was her weight. And that's something that she probably has experienced her whole life. So this just reinforced her idea that going to the doctor is just being shamed or fat shamed, given a 1,200 calorie diet that she has tried multiple times. She has tried multiple diets and multiple exercises, and she knows that even though she might lose a few pounds, she usually regains them. So what's going to happen with this patient? She's probably going to toss that 1,200 calorie meal plan. And the problem with all of this is the disengagement from healthcare. This patient is probably not going to go back in a month. So this patient is not only not going to do the weight loss strategy that was recommended, it is also not going to go back to that physician. So this is the real problem with weight stigma, is that patients feel stigmatized, feel discriminated, feel unseen, and they don't want to put themselves through that again. So if there is a disengagement from healthcare, then there's probably a disease progression.